This is Akashvani Churachandpur, broadcasting from FM 101.4 MHz. We are happy to have with us here Dr. Nengchinkhup Munsong, eye specialist, on the topic visual impairment, its causes, treatment, and prevention to mark the Blindness Week. Welcome to the studio, Dr. Khup.
Yes, thank you.
Welcome once again. Let's start with the basic question. What is visual impairment? Kindly tell us.
Visual impairment means any disturbance or impairing the vision of a person to see normally with a lot of reasons. But basically, visual impairment means the person who is not seeing as good as who are normal.
Okay, thank you.
Yeah.
Let's come to the next point. So, as we are talking about visual impairment, kindly tell us some of the main causes.
Some of the causes may be defined in many ways, like in childhood, it can be caused by trauma or some infection, or otherwise not taking care of the eye during childbirth, or after some time when the child is growing, and then after that when the child is playing. All this time we have to be really thoughtful about anything which can disturb the child's vision, which may not necessarily be inherited from the mother, or it may be just from other things, like even these pellet guns, which are the children, most of them they used to play with them, and stick and sometimes stone, whatnot. And also in the older age also we have something like age-related macular degeneration, or say not necessarily due to old age, but most of the time it happens in the old age, such condition as cataract. And then you have what we call it glaucoma. That's optic nerve, where it affects the optic nerve. Okay. Basically, this rise in intraocular pressure and thereby causing this optic nerve, optic neuropathy. And so this can be due to many causes again, but then we'll just broadly say that glaucoma, cataract. And then after that, we also have these other conditions, like for example, what we have due to some infection or some intraocular infection. So many causes which can disturb the vision, or that the flow of that light and hitting the retina at the fovea. Anything which disturb that visual part it can be due to many causes, but these are broadly, we can say, causing visual impairment. And then on top of it, from the optic nerve to the brain, as it goes along this path to reach the brain, there may be many neuropathy or these problems. So all these things can cause
visual impairment.
Impairment, yes.
Okay, this let me just quote one of the term, cataract. Just tell us in short, how does this cataract cause visual impairment?
Cataract is in its Oxford dictionary meaning is waterfall.
Waterfall. Okay.
Yeah. So what happens is when a person standing behind a waterfall tries to see beyond that waterfall, he will not see it very clearly. Something like a blurred vision. Yeah.
Okay, thank you.
So that's why cataract is the name given to that.
Okay, really
And
nice. Okay,
how
one
it-
thing before that. Okay, one thing before that, I want to ask you: can cataract surgery restore vision? This is a
the
small question, but it's very important. I think.
Yeah, actually, by God's grace, cataract, even though it is a debilitating visual deficiency, but then now with the achievements and technological advancement, this is where science really meets the need of the medical disease. So in this, what I mean to say is, if we try to remove that lens, anatomical lens, which is becoming cloudy or which becomes more dense, we clear out all those things, and then we insert what we call it pseudophakic IOL. That means something like the natural lens, but this is a different artificial one called this plastic or other type silicone, etc. So we put that one inside, and with the technology, we try to measure the power of the lens which the person will need, so that the person may be able to see clearly far, or if we want it for near vision, for near, like that. So nowadays, with good advancement, it's becoming more of an OPD procedure. You come drive in to the medical doctor, and then the doctor will just, with just about 1 hour, you can have a new eye, a new vision.
Okay. Is there any difference between glaucoma and this one, cataract? They're more or less the same.
No. Basically, glaucoma is an optic neuropathy that is affecting the eye. So initially, we thought, medical definition is, it is more of a like pressure inside the eye, the globe, building up and pressing back to the optic nerve, and thereby causing what I should say damage to the optic nerve or optic neuropathy. But nowadays, the definition becomes more enlarged. So basically, it may have a rise intraocular pressure or may not, but definitely have a problem in that optic nerve, the optic nerve becomes more of like swollen, and then after that it becomes atrophic. So basically, it's optic neuropathy, and so nowadays we call it. It may be the pressure may be very high or very low or sometimes normal. So we call those things as normal tension glaucoma, and this can be different from other glaucomas like which are related to pressure. But one of the most common thing in these our places is narrow angle glaucoma. Some books some of the books which we come across previously, these our Southeast Asian race. They thought that we are supposed to be having more of a primary open angle glaucoma. Yes, that may be true if we have more of advancements with this instrument, gadget, and all to check the ocular pressure. And with the coming days, people becoming more conscious about their eye health. But basically, some of the really disturbing thing which I used to come across is like in the village and all. some of these elderly people, they have this narrow angle glaucoma. And when person has a narrow angle glaucoma, it causes headache, pain, as well as like vomiting. So most of them, they just wanted to treat themselves with this paracetamol and whatnot and all. And very sadly, when we come across such patients after 3 days, many of their visual losses cannot be restored.
Okay. What will be the causes of this glaucoma? Just give us in one sentence.
Oh, maybe it's like I just said, anatomically or due to other hereditary things, and then this can cause ciliary blockage, and then trabecular meswork, it becomes blocked, and then so basically that increase the pressure. So that's how.
So we cannot have a definite prevention for that, no?
Yeah, we may not have, but then we can rule out some of the people who can have these things, glaucoma. Like for example, if there is a lot of this, what I call melanin pigment, usually they have this glaucoma in the later part of their life. And such things, as well as like open angle glaucoma, you have to treat the patient. I mean, you have to check regularly if for like people with diabetes, hypertension, etc. Because this can all coexist together.
Thank you so much. Now let's say that diabetic retinopathy. Please explain it, what it means, and what are the causes, if there is any, and how we have to do the treatment, and if there is any preventive measure, that also please add it.
Diabetic retinopathy is a condition where usually a person suffering from diabetes, especially uncontrolled diabetes, and these people, it affects their blood vessels, and so in such a blood vessels and all, the problem is this blood become more slow in moving. I mean, turbid, something like that. So that the flow is not very good. When the flow is not very good, then the peripheral part of that nerve, blood vessels, they die or say become anoxic. And then after that, that blockage, so that blocked area, because it's a very important part of the body, important organ, it has to have immediate blood vessel supply. Yeah. So what happens is the retina in around that blood vessels, we have these new blood vessels called neovasculars. So when these things are developed, this neovascularization develops, that is one thing good, but then these neovascular vessels, they become like, suddenly they stop supplying blood and then becomes dead. And so it becomes a fibrous tissue. And these fibrous tissue are very dangerous because when it contracts, it can pull the retina. So that what we call it, retinal, this thing, RD, no? So sometimes the vessels can just pull out this retina.
That means it
retinal
can cause blindness also, no?
Yeah, it will definitely cause visual impairment, then blindness. So this retinal detachment is one very dangerous thing.
Okay.
But then, just a moment,
Okay,
I just want to add this one.
Please do.
If you are suffering from diabetes, and you should not be so scared immediately that I may have some problem with the eye. But then after the diagnosis, till about 5 years, most of these things doesn't occur in the eye. 5 to 10 years, usually maybe, and then 10 to 15 years, most of them develop this retinal problem.
And we are really thankful to him, and have a nice Blindness Week. Thank you.
Thank you.